National News with Lisa Laflamme.
Good evening. Life as we know it will be different for a while. From the way we work to the way we play, learn, and the way we welcome visitors. It is all profoundly altered by the COVID-19 pandemic. The Prime Minister has closed Canada's border to most non-residents. There are new limits on crowd sizes, and in every province, no school. We're at 441 confirmed cases, 3 new deaths, bringing the total to 4, all from that same BC nursing home, and 12 recovered. Globally, more than 180,000 cases with more than 7,000 dead, and again, an important number, 79,000 recovered. Now, 2/3 of the Canadian infections are travel related, so tonight most of the world is shut out and Canada is shut in. CTV's senior political correspondent Glenn McGregor starts us off.
Travelers arriving from coronavirus hotspots are surprised by the lack of screening. This woman coming home from Italy.
The screening here is actually fairly lax, I would say, compared to what I've seen.
And this couple arriving from Spain. Their temperatures were not taken.
We've been traveling for a while now in airports, so they probably should have maybe done it again.
Toronto's Pearson Airport is now one of only 4 across Canada accepting travelers from overseas. And even here, new rules have yet to roll in. Coming soon are the strongest measures yet to reduce the number of travel-related cases of COVID-19.
We will be denying entry to Canada to people who are not Canadian citizens or permanent residents.
Canadians outside the country can still return, but will be asked to self-isolate for 14 days.
Let me be clear. If you're abroad, it's time for you to come home.
There is an exemption to this travel ban. U.S. citizens can still come to Canada for now. Most incoming international flights will be redirected to airports in Toronto, Montreal, Vancouver, and Calgary. With chaotic scenes in the arrival areas, some cities and provinces are sending their own officials to augment CBSA agents, one of whom tested positive for the virus.
I would like to reiterate that the federal government takes the situation very seriously and that we all work together.
Airlines will now be required to conduct their own health screenings of all Canada-bound passengers before they board. Sick Canadians kept off flights will be partially compensated for extra expenses from staying away. Passengers arriving at airports are being asked if they have symptoms, entering their responses on kiosk touchscreens used by thousands every day. Only a few days ago, the health minister said shutting down borders wouldn't help control the pandemic.
Border measures actually are highly ineffective and in some cases can create harm.
But now the government says the situation has evolved and is warning people to stay home away from large groups.
Public gatherings of 50 people or more is to be avoided.
With the number of cases rising in the U.S., it's an open question how long Americans will still be allowed in, and one complicated by the close economic relationship and the need to keep goods flowing across the border. Lisa.
All right, Glenn McGregor in Ottawa tonight. Thanks, Glenn. As much as Canadian life has changed, Canadians' capacity for compassion hasn't.
So call your friends. Check in with your family. Think of your community.
There is only one community in Canada so far, though, dealing with death from COVID-19. BC Bureau Chief Melanie Meiji has the details.
At the Lynn Valley Care Centre in BC, a COVID-19 outbreak has claimed more lives.
The sad news is that we've had 3 additional deaths.
A man in his 80s also died here last week. There's been a cluster of cases at the facility, including at least 12 staff who are now ill.
The outbreak report that I received from Vancouver Coastal was that they were continuing to find cases popping up.
There's also been a handful of infections at another Metro Vancouver seniors home and at a busy provincial hospital. But unlike Lynn Valley, those locations are not reporting any deaths. Many families at the centre are now grappling with whether or not they move their loved ones.
Everybody's a little bit fearful.
About a 2.5-hour drive south of the Lynn Valley Care Centre is the Life Care Centre in Kirkland, Washington. The nursing home has one of the biggest cluster of deaths in the U.S. At least 29 people have now passed away. Washington State has 769 confirmed infections. Because of that, the BC government desperately wants Ottawa to reconsider the travel ban exemption for U.S. visitors.
It's our strong message that visitors from the United States not come to British Columbia.
Canada's Deputy Prime Minister says she's working with BC specifically to address concerns, but she also said
every single province and territory in Canada has extremely close, extremely dense social and economic connections, human connections with the United States.
Officials here will continue to press the Prime Minister on his border decision. In the meantime, any Americans who come to BC will have to self-isolate. Lisa.
All right, Melanie Nagy, thanks for this tonight from Vancouver. Nearly 34,000 Canadians have been tested for the COVID-19, and among them, Alberta's Chief Medical Officer.
I felt well yesterday, but woke up with a sore throat.
Taking her own advice, Dr. Dina Hinshaw is in self-isolation, waiting for that result. Every province has taken its own approach to managing this outbreak, and messaging doesn't always align. CTV's Quebec Bureau Chief Geneviève Beauchemin on the patchwork of policies.
Much of Montreal is now closed for business. Quebec's containment measures mean restaurants, including Rex's, a half-century-old institution here, have been ordered to cut capacity by 50%.
From 30 seats, we brought it down to 15.
And now owners question whether Quebec may go even further and shut them down. In daily briefings, Premier François Legault was first to impose some of the most drastic rules in the country.
Chaque geste.
Every little thing counts, he told Quebecers. Days ago, Legault banned visitors from long-term care facilities and hospitals, a heartbreaking measure for those forced to leave their elderly parents' bedsides.
I didn't know when I'm going to see him again.
Quebec shut down all schools, universities, and daycares, bars, and gyms. Until this afternoon, neighboring Ontario had maintained not all those rules were necessary yet, but today advised against gatherings of 50 or more people.
And all bars and restaurants, with the exception of those restaurants that could continue to do takeout and delivery.
In BC, where the virus has been deadly, there's no province-wide policy on bars and restaurants, and no policy yet on whether schools will shut down after students return from spring break. Quebec declared a state of public health emergency March 14th. Calgary declared a local emergency on the 15th, and today it was PEI. Different rules across the country on different timetables that have increasing numbers of Canadians asking why.
What we're seeing is that no, patchwork will not work in this case. We are needing a leadership position. We need a leadership policy that tells us and mandates what all the provinces should do.
But most health policy experts in all provinces do agree bold containment measures are necessary based on science. Lisa.
All right, Geneviève, thanks for this. Well, of course, not everyone is grasping the gravity of this pandemic. No social distancing on this Florida beach for the spring break. Cringeworthy for scientists warning against any close contact. Washington Bureau Chief Joy Melvin joins us. Joy, it seems even the president is now bowing to reality.
Lisa, tonight, a much more urgent message from the U.S. president, who has repeatedly downplayed this crisis.
Avoid gathering in groups of more than 10 people. Avoid discretionary travel. And avoid eating and drinking in bars, restaurants, and public food courts.
Across America, life is changing at a head-spinning rate. Nearly 7 million people in San Francisco ordered to shelter in place. In major cities, restaurants, bars, and schools are shutting down. An all-out effort as governors from state to state restrict people-to-people contact. Donald Trump admits the coronavirus is not under control, and battling the outbreak could drag on through the summer. Trump says he told his own son, Barron,
and he says, how bad is this? It's bad. It's bad.
But in Seattle, a hopeful first shot as the first volunteer tested an experimental vaccine.
And the individuals will be followed for 1 year, both for safety and whether it induces the kind of response that we predict would be protective.
Even if the research does go well, Lisa, that vaccine won't be ready for at least a year.
So much pressure.